Hello. So just give us a moment to shift chairs a little bit. Room only.
Like, I'm not going there.
Too many people.
All right, so I'll just jump back in. So welcome for those who just came to join into the top scrum room. I just want to do a sound check for being most often on the receiving end of teleconferences. I often am thinking I'm hard of hearing or the speakers aren't close enough, but is everybody hear us A-okay? Excellent. And I'm just going to ask people while they're not talking, if you don't mind putting your phone on mute, and then we can just avoid any of the paper wrestling. We don't have a formal presentation for you. What we really wanted to do was just give you some information about what we know in regards to where things are at with the Central Patient Attachment Registry work here in the province. And I thought it could summarize in one statement where they're at, I would say, changing. Landscape with this work, which is focused on continuity, which we all know is a really important priority focus for primary care here in the province, and that is that continued focus on that patient and physician relationship, as well as with the team, and seeing patients seeing their own physician and team the majority of time. That continues to be a really important focus, and that has not changed. What's changing is that how we're going to go about releasing the Central Patient Attachment Registry. There's been a lot of dialogue going on right now about what's the next best steps forward. And Chris and I are going to be providing, as well as Mark, some additional information regarding that. I want to, before I hand it off to Chris and Mark, though, I want to just another minute to say, if there's one or two things that you could leave with today, that would be the key message that our continued focus on supporting the patient's medical home and that relationship between the provider and patient is strong. And there's a lot of work to do in the domain. We spent the last few years working on panel identification, panel maintenance, and having PCNs support primary care practices in that work. The tremendous amount of work yet to do in some practices in Alberta who have not prioritized this, as well as those practices who have. There's important work to do to start using those panel lists to plan clinical care differently, and often use that term panel management. So move from panel identification to panel maintenance, knowing who's on their panel list, keeping it up to date all the time, to management, being able to print lists and being able to plan the delivery of clinical care without a wait for their patients here in Alberta. Really a tremendous amount of work to continue to do in that area. I wanted to use a specific example because I think many of you know we're working right now on some initiatives to strengthen the patient's medical home that's around complex care planning. That's actually about using that panel list to identify those patients in a practice who are complex. We're doing some work around the opioid initiative. And part of that opioid initiative is going to be able to use that panel list to identify patients within the practice who are actually using opioids. And that may be for acute pain, for chronic pain, and or misuse. So these initiatives are focused on being able to support the practice, use those panel information, all part of this continuity journey forward. Now, changes are around the central patient attachment registry tool itself. For those of you who may not know, the tool is built and here in the province within Alberta Blue Cross. The details of testing it were sort of underway. And this was a stepping stone to a fully automated system that would be connecting with primary care in time. And part of the CPAR work was to develop sort of interim tools to get us going, get the ball going early to advance the benefits of the central registry to sort of really continue to drive that patient's medical homework forward. And this is where the landscape is changing, and Chris and Mark are going to tell you more about that. Before I hand off then, Mark, is there something that you want to add at this point just on some general messages? And then we'll ask for you. Chris is going to provide a few more details here. Mark, you wanted to add?
No, I wanted to, again, I think it's important that our focus on continuity has not wavered. We're talking about a very important aspect that's going to enable continuity to progress, and within that, it's one step within that. So I just wanted to kind of put this in a bit into, again, perspective that this is not a massive change in direction. This is a change in around implementation, or a potential change around implementation, just to kind of give it that factor.
There might be a change in timing of implementation of CPAR. CPAR is here to stay. It's just how do we go about leveraging it is important at hand. So, okay. So, Chris, I know you want to provide a few other details here.
Yeah. So I'll give you as much information as I can about what's happening with CPAR itself right now. As Arbel has said, the landscape keeps changing. If we give you this update on Thursday, you would have information today because things changed again on Friday. So I'm going to give you as much as I can today, and please bear in mind that it could change again. I acknowledge, for those of you who are on the front lines and who are out dealing with our customers every day, pressure that you're feeling. I want to acknowledge it because I'm feeling it too. I have unanswered emails in my inbox asking me specific questions about CPAR and what's happening with it. Know that Doug Bell acknowledge that and understand it as well, and they've been doing that. But as we've said, the landscape keeps changing. Doug and Mike Gormley have been working with our part of Alberta Health, and we've been at the way things have gone. Everyone's trying to do what they think is best in the best interest of Albertans, and I think we have to recognize that as well. Alberta has a different perspective than we do, and the mission is slightly different than ours, and so we have opinion around CPAR, but we both recognize that CPAR needs to happen, and it's just a question of how it's going to happen. I want to get that out there before I talk about what's going on. Bill said the vision for CPAR was always the state would be uploads through CII. It was always around when could that happen, and as we went through the development of the project, it looked like that could happen sometime in the fairly distant future. So an interim of uploading to the CPAR and starting to use it more quickly was agreed upon as the minimal upload that we've been talking about for the last year and a half, where patients could upload their panels from their ERs to CPAR. At some point, Alberta Health decided that it wasn't financially viable to pursue both the interim measure and CII. They opted to go with CII. We did that, and we fought the fight. The Deputy Minister, Mike Gormley, met with the Deputy Minister on a number of occasions, but we didn't win that fight. And that's unfortunate, but that's where we are today. What changed possibly as of Friday Alberta Health indicated they might be interested again in looking at an interim solution. Indicated that to Doug when he was meeting with the board of directors. Is that correct, Arvel?
Yes.
So that's left us in a bit of a quandary as to what exactly they mean by that. Are they thinking that maybe CII isn't going to happen as quickly as they thought, and so they're back on the table? Is this an olive branch? We just don't know. So, yeah.
Just a question had come in. So not everybody on the call knows what CII is.
Okay.
Yes. So,
I can do a quick.
For sure.
Quick. So CII, sorry to those who were, I apologize. CII is a project that Alberta Health has been working on for some time, and it's of two things. It consists of a hub that can automate the movement of information between different healthcare systems. In the case that I'm discussing here, it will automate information from community EMRs into the data hub, and then from there into Netcare, and also in the reverse. It could automate movement of information from Netcare through data hub into community EMRs, which very good thing. But physicians have been a little bit skeptical of it because it's very much in its infancy. I think that's part of CI is a database. Alberta Health would very much like to get this information so that it can do the kind of deep analytics on what's being delivered and how it's being delivered and who's delivering it that most high-level healthcare systems have the ability to do, but it does not. So I hope that makes some sense.
I think, Chris, you made some really good points here. The community information to Netcare is really an essential ingredient as we're trying to coordinate care better here in Alberta, because I think we've all experienced where you land up, you've been merged, but your family doctor doesn't know that, or you've been in the hospital and discharged and then get the information. And so having the sharing of information between primary care and other parts of the system is going to be a really good thing. It's just they started this work just recently with this community information to Netcare project, where it will be a fully automated steps between primary care. Not all the record is shared, just certain parts of the record is shared that are probably more relevant to other care providers and other parts of the system. That project in itself is fairly new, although they do have some is tested with HealthQuest.
HealthQuest, yeah.
Yes, yeah. So this is a good thing, but it's a big change for primary care to sharing information, with other parts of the system. Mm-hmm. Just to give it a bit of relevancy, it's also a good thing because primary physicians start to get those notifications from other parts of the system, because sometimes that doesn't happen reliably now, like from ER or from hospital. So it's the sort of non-technical side, more from us as individuals experiencing healthcare in the province.
Yeah, the policies with the CI are quite exciting, but it's like, as I said, it's still in its infancy, and it's got a ways to go yet. So that's today, and fire questions at us if you have them. Know that we've been working on delay messaging that you can use in the community. We've been working on it for some weeks now. Sensitive because we are in this with other partners, so Alberta Health and Alberta Health Services need at least have their eyes on it before it can be released. And then we want the General Practice and Primary Care Alliance to have a look at it. They're going to have a look at it this week. And we're hopeful that by Thursday, Arbel, is that?
Yes.
Thursday, Friday morning, we'll be able to get them to you guys, so that you'll have them first before they're officially released.
So, yeah, great. So thanks, Chris. So I wanted to just recap then some specifics. So there's a couple of ways to go about advancing this initiative, the Central Patient Attachment Registry. One is to get going right away, and that's what we were hoping. We were hoping that we get practices going right away and using a semi-automated process to upload their panel data to the registry. And we were really committed to do, when we've been talking about that, as Chris said, over the last year, Andy had built a translation component to that work, and we were ready to roll. Really, until near the end, that we recognized that Alberta Health had said there were financial constraints, and that they were really wanting to invest most of their effort into the fully automated, again, which is also a good thing. Fully automated process is. And so that's where you could see where this changing environment, where they'd had discussions, the half marathon get going, or wait for the, until everybody's trained for the full marathon. To be honest with you, I don't know if there's a right or wrong answer here. I think it's just that we'd gotten people excited to get going now. So there will be some groups who could, in fact, get going now in the very near future, in the fall, with some of those EMRs that have been tested with the III. But there will be, this will be spread out over a longer period of time if there isn't agreement for an interim solution. So I'm sorry we don't have all the answers, other than we were going to go fully interim solution, and now we're sort of in this bit of a seesaw of saying what's the better option, interim, or wait for this full availability of the full automated system. So that's why there's been some sensitivity on saying a set of messages, because we aren't actually 100% sure where we've landed here.
Mm-hmm. And if I may just add, and so another reframe on this would be from a value perspective. And the value perspective in the interim step maybe has less to do with majority of physicians who may not even be aware of some of these impacts, where some of the longer-term benefits, as you describe, around how do we get information to and from the system is goal. And so it's just about how much effort are we placing to achieve certain value for our physicians. That's the decision that we're really trying to make sure that we're getting right. So really the value that we're able to provide physicians through the interim step, as well as through our long-term vision for how that information flows to and from Netcare.
And so what are we asking the team to do? Well, we're asking, if questions arise, you can share. I think important that we're the high-level messages, not getting into the weeds about the messages, that we continue to have a priority focus on continuity here in the province. There's a lot of work to do on panel identification, panel maintenance, and panel management. Right now, the timelines might change regarding the patient attachment registry, and whether they're going to go with a fully semi-automated process or a fully automated process through central or through community information to Netcare is still under discussion. We will have those written in down for you, and as Chris said, we just have the physician leader groups having discussions about them this week, and then we'll get them to the team. But in the meantime, if people are asking you, that's the level of detail we would want to be able to provide to them. And if you want to have more information about the detailed discussions that occurred, they certainly can contact, physicians can contact Dr. LeBuick. He's the lead on this initiative. But for now, I think our messages at a high level are important.
Would it be reasonable to deliver the message that if you've heard rumors that CPAR is dead, or that it's delayed for 5 years, or that those are not true, that it's delayed, but it's going to happen? Both Alberta Health and the AMA and Alberta Health Services want it to happen. So the decisions now are not about whether it will happen or not, but it will happen.
Correct. Great. So let's open it up for questions. We basically told you everything we know purposefully, and that because some physician leaders are well aware there had been both AMA and AHS and Health all had a different desire. They really wanted to get going now, and Health is saying, let's hold out for the, the big run. And that was the debate, was back and forth. For clarification. Lori, Gary, do you have, I know that Cal had prioritized some of this work. We hope they continue to. It just may be a matter of timing now.
Yeah, no, that's good to get the clarity on the messages, and I know it's been a moving target for the past several days, so good to know today's State of the Nation. Some messages. Thanks.
Our bell question. It's June Austin. Hi, everyone. I just wondered, so that's great that our team now knows the message and where to keep the level of the message, et cetera. Is there any discussion about would be like a global message that goes out to like PCN leaders or even from the SGP or something like that?
Yes, in fact, that's the goal. The goal will be by Thursday this week. There will be messages of clarification that go out through SGP, through Dr. LeBuick. They would use Primary Care News. We'll send messages directly out to the executive directors, PCN Physician Leads Executive. There's discussions tomorrow at the Primary Care Alliance group. So exactly that, June. By the end of the week, there's actually printed messages that are going out through a number of mechanisms.
And then we'll have our messages, so then if any inquiries come in on the front lines, we'll be able to address them.
Yes,
yes.
Yeah.
Alexis has already started working on a communication plan for the messages once done.
Great. Was that?
The other question I'll put in here, Arabella, this is Mark, is if following those communications that happen on Friday, that the specific questions that teams asked aren't being answered, where should they go to help field those requests?
Great. I think right now, Mark, that's you and Chris.
Yep.
Heard a chuckle.
So, Mark, I guess probably me.
Oh, hang on, Mark.
No, I did. I purposely threw that question, Arvel. I knew the answer.
Well, because I think here this is where it's really the marriage of the if the tool isn't ready right now, what is, what can we be focusing on and working on? Because there's so much work with the the other part of the coin saying, this tool going to be waiting for this fully automated play and it will be occurring at such a time. We don't know that for sure. I'm just anticipating the various questions. So Mary, two messages are really important. Now, from there on, any specific questions that you might advise or give recommendations on? Questions?
I guess I would suggest maybe you confirm for us so that the leads have an understanding of what the physician leads will get and when they'll get it. So some of them might be at SGP or at places, but it would be helpful that if when the messaging does get sort of finalized later this week, that we know when the leads will have had it so we can have a conversation with our leads. And if there is an event where the leads are whether you brief them again on it, then it'd be helpful if maybe you think about dialing us into the same call.
Yeah, good suggestion. So you have our commitment to get these messages in the hands of the zonal implementation teams and the team leads, the entire team, before they news rack. And so we'll make sure to do that. But I like that idea as well, as if there are calls that are going to be pulling groups together, that make sure that we have our field teams closely linked to them. So thanks, Bill.
Hi, Arvel, Chris, it's Angie. For those of us that have been with some of our customers and they've espoused the rumor mill, you know, CPAR is dead. Do you recommend that we go back now, sort of actively intervene to correct the messaging now, or wait until that official messaging comes out?
You know, I think I'm going to leave it up to I really am. I think that if you, for example, I'm aware that Calgary has an important meeting that's coming up today or tomorrow. You know, Bill and Lori and others were actively, you know, briefing the chair of that meeting. And so I think that's a very proactive approach so that they know as those questions are coming up, they're able to verbally respond. So I think I would leave it up to the team leads and yourselves just to decide where you should proactively go after that, or if a couple of days is going to be okay.
Okay, thank you.
And I'll reiterate to Arbel, that is the purpose of us being on the call today, to give you as much live, up-to-date information as you can, so you make those decisions, Angie, around here's when we expect the official news. And again, it's when we expect. We could always be thrown for another change, which we hope not. But to give that to you so that you can make those decisions that you see most important based on your relationships.
Hard when you circulate things in print, so that's why we thought we'd arm you with some verbal key messages here as the questions are rising. So you have that latest information. You know, Lori, improvement facilitators are a group that have been asking a lot of questions. I don't know if there's any opportunities right now where, you know, you'll be, you know, there's an IF training this week, for example. Again, I think that provides a bit of a proactive opportunity, but some of these champion type groups, physician leader champions, improvement facilitators, your MR groups, you know, will want to be positioning messages for them as well, because they're at the front line getting asked these questions every day.
Yeah, like I just think with it being such a moving target, I mean, things are kind of happening by the half day, I want to say quite hour, but with things moving so quickly, I think right now we might be better off just winging a day or two to move ahead with anything until we do get the official messages. And if things change and our inboxes are filling up and our phones are ringing, I think then we can assess.
Great. Andrea?
Arbel, it's Al Fabiani calling. I thought I'd just jump in and just mention that SGP executive are meeting on Thursday, and they will be discussing this with Doug. I suspect that's going to be influencing the messaging going out, so we might just wait for all of that to.
Exactly, Nella, and that because Daryl and SGP have been the sponsoring group of this initiative, what you say is very important. So thank you. Great. Any other? Yes.
That's another question. While our teams with some specific messages, will that be the only messages that come out, or will groups like SGP or other groups also have some messages that might be official messages that come out in addition? And we are committed ensuring their team has those as well.
Good question, Mark. I think that there is going to be the level of detail for a message, for example, for the physician leader groups, will be much more in depth than the frontline practicing physician and their team. And I know that the level of messaging right now, even at SGP, because they've got a lot invested in this and they understand the pros and cons of, you know, a semi-automated approach versus, you know, the fully automated. So I think the answer to that is definitely yes. we're probably going to see a team. We'll see all those sets of messages. We'll see at a very high level, targeting our frontline groups, and we'll see some that are more detailed, targeting our physician leader groups who want more information.
Maybe what I'll commit to, because I know that Dr. Daryl LeBuick is going to be doing an SGP bulletin on CPAR immediately after the SGP executive. So commit to forwarding that bulletin to the integrated team so they're aware of what's going out to the physicians on the ground.
I just want to jump in a little bit around that, because if he's sending that out immediately afterwards, we had planned on sending information to the PCN leadership, so the executive directors and the physician leads, prior to anything going to general membership. So if we can just connect on that to make sure that there's that we get that piece into the other overarching plan, because I just hate for us to get out ahead of the PCN leadership.
Yeah, good catch.
Connect with me, Alexis.
Okay.
Any other questions coming to mind? Well, hearing none, I just want to thank everyone. Thanks, Chris and Mark, and everyone who's contributed today and asked questions. And we'll be in touch, you know, as we information start to be clearer. So thanks so much.
Thanks, everyone.
Bye-bye.